Can you guys see my screen?
Yes.
Okay, awesome. And is the screen moving?
Yes.
Okay, great. So today
Yeah.
we're going to talk about ergonomics. So that deals with adaptation of the work environment to the human body. Now, this is really important because if, and as we talk about this a little bit more, if you guys don't um, take care of your body, how are you going to be able to work? Now, I've been in this field for 35 years. I started when I was 5. Of course, I'm just kidding, but no, I started when I was 5. And so if I didn't do ergonomics properly, I would not be able to do this job anymore. So we're going to talk a little bit about this in a second. So ergonomic conditions are the safest, most efficient, and easiest way to work. The word ergonomics comes from the Greek words ergon, which means work, and nomis, law of work. The goal of ergonomics is to help people stay healthy and at the same time perform work more effectively by changing design of the workplace, instruments, systems, products, training, and some combination of these. So we want to make sure we have good practices, staff training, equipment design, instrument design, workplace changes and balances, and exercise. And if we have all of this, we have ergonomics. So a lot of times when you guys come into the lab and you sit and you're not sitting properly, I'm going to ask you to sit properly. I'm not trying to nag you, but I'm trying to make sure that you start focusing on the way you sit, because some people don't even realize it. So that way, if you love this job, you will be able to continue without having backaches, neck aches, arm problems, things like that. Now, musculoskeletal disorders, MSDs. These are headaches, neck and shoulder pain, back pain, carpal tunnel syndrome. Um, of course, your wrist, because we work a lot with our hands, account for many disabling and potentially career ending musculoskeletal disorders among dental professions. Work habits, posture, and equipment and instrument design can contribute to these work related disorders. So, for example, I've been doing this for a really long time. So, in order to do it, sometimes I even go to the chiropractor so they can adjust me. So, not only do I try to make sure that I follow the factors that we need to do, but then I go a little bit above and beyond and go to the chiro. Now, ergonomics designs the work area and the tasks around the human body rather than requiring the human body to adapt to poorly designed equipment and working environments. So, members of the dental team usually perform their work in a seated position, often with excessive motions and unbalanced postures. Work related musculoskeletal disorders can include back pain, joint pain, neck and shoulder pain, hand and wrist pain, and headaches. The early onset of pain should alert you to an imbalance, and if it is ignored, more serious damage can occur over time. So as soon as you feel a little bit of pain, that means that you might be sitting awkwardly. Like for instance, this girl in the letter A. So she is sitting horrible. Okay. So this chair, by the way, is called the dental assisting chair. And I'm going to post a video on items in the laboratory that you must know, that you should watch the video and identify each one of them. So again, this is the dental assistance chair, and the dental assistance chair has a bar in front of it and a ring on the bottom. The ring is for our feet, of course, and the bar is to help us stabilize our posture. So if you look in letter B, she's sitting much better in the chair. Now, it is important for you guys to understand how to implement ergonomic changes and methods. And 3 interrelated factors contribute to increased risk of job-related injury. Posture, as I just mentioned with the girl that was sitting there. Repetition. So we do a lot of stuff that is repetitive. So we have to be careful that we make sure that we are following the factors that I mentioned before, and of course, sometimes force. Now, posture affects ability of the dental assistant to reach for, hold, and use equipment. Also influences how long the dental assistant can perform a task without suffering adverse health effects. Any position will eventually become fatiguing and may lead to lower back pain. Consider alternating assisting at chairside with other dental assistants in the office to give each one of them some variety in positions. Well, I'm going to tell you one thing right now. When you go and assist the doctor, and if you're his assistant, usually you're his assistant from the beginning to the end of the procedure. Alternating assistants, that is not a factor, okay? Unless it is truly a long procedure, like a surgical procedure, and the doctor might require more than one assistant. But again, normally you are the assistant and there's nobody to relieve you. Now, a neutral position. You want to make sure, and I'm actually going to bring up this while I am talking about it. So you want to make sure that you are at a neutral position by sitting upright with your weight evenly distributed. Your legs should be separated. So if you notice this girl right here now, guess what? She is no longer sitting in the dental assistant chair. She is sitting in what's called the operator chair. So if you're sitting in the operator chair, which is usually the chair that the dentist sits on, but on occasion we sit on it too. Make sure your back is up against the back chair, okay? So your back should be pressed against the back of the chair for lumbar support. Your hips should be tilted forward to rotate the pelvis backwards. So your spine should resemble a gentle S. So this should look like a gentle S. When the spine is properly aligned, ears, shoulders, and hips are in straight vertical alignment, providing balance, support, and equal distribution of weight. So this is perfect, and this is how you want to sit in the chair. Now, deviations and problems. There is a tendency for the dental assistant to deviate from the neutral position while assisting the dentist. Examples include leaning forward, twisting, overbending the back, and reaching. These poor postures can lead to aches, pains, numbness, and tingling. Ideally, sitting and standing should be alternated whenever possible. So sometimes I do sit and sometimes I do stand. It all depends on the procedure that we're doing. And nobody's going to tell you whether you should sit or stand. I know some assistants that do everything sitting down, and I know some assistants that do everything standing up. And then there's some like myself that it will depend on the procedure, and I will either sit or stand. Now, there's a tendency for the dental, I said that already. Frequent reaching, twisting, and working with the arms in awkward positions can cause strains and sprains. Extreme stretching of muscles or ligaments causes strains. Sprains usually involve a sudden twisting or wrenching of a joint with resulting stretching or tearing of ligaments. Shoulder problems can be caused by repeatedly reaching behind the body for instruments or supplies. So when you come into the office, and even in our lab, everything is reachable. Okay, what's not reachable is things that you forget. So things that are in other places that you forget, you need to get up and go and get them. Please don't roll that chair everywhere you go. You only roll the chair inside the operatory. I have seen some lazy assistants not get up from that chair and roll that chair during the whole office. And I'm like, what are you doing? Okay, no. The chair stays in the operatory. You get up and get whatever you need. Reaching movements. Keep the air, water, syringe, handpiece, saliva ejector, high volume oral evacuator within a normal horizontal reach. Keep the operatory light within a safe maximum vertical reach. Other supplies used less frequently should be placed within the maximum horizontal reach. Reaching behind your back and lifting can cause shoulder injury, and when turning is necessary, rotate the chair rather than twisting your body. So the great thing about the chair is the chair is very movable. You can twist in the chair, so turn it around. You also can fall off the chair if you're not careful. So you have to make sure you're also careful with that too. Now, we talked about repetition and force being one of the factors. So repetitive motion over flexion and extension of the wrist can significantly increase the risk of cumulative trauma disorders, particularly when the task requires force. To help prevent CTDs, periodic breaks and alternation of difficult procedures with less stressful procedures are recommended. One common CTD is carpal tunnel syndrome. So usually the person that gets a lot of carpal tunnel syndrome is the hygienist, because she's doing the same thing all day long and basically doing cleaning of the mouth. Now in this picture here, you have two assistants. As I mentioned to you, it's very rare to have two assistants in the operatory unless it's a very, very long procedure or a surgical procedure. Now, don't get me wrong. On occasion, you can be in the operatory and you might have forgot something and you see an assistant pass by and you can say, hey, miss, you know, whatever her name is, can you please go and get me blah, blah, blah. And they can do that. So I'm not saying other assistants cannot help you. I'm just saying that you usually don't have two assistants and one doctor. Now, who can tell me what's wrong with this girl that's sitting down here? What can you guys see?
Her back.
Yep, her back. Anything else?
Her hand.
Yep, her hand. So the way she's holding the suction, that's gonna get old real quick, okay? Because your fingers can only hold it that way for a long period of time. So that's something that I will teach you. Of course, as you guys notice, the back, I will say this too, the light is kind of far. You know, if you can't reach up and actually touch the light without getting up from your seat, it is too far. And then everything else looks like it's pretty much where it needs to be. But yeah, chair is super important, and hand. So the carpal tunnel is an anatomic area of the hand or wrist. With improper motion, the tendons swell, exerting pressure on the median nerve. The first symptom of CTS is a painful tingling in one or both hands. Decreased ability and power to squeeze objects or make a tight fist may follow. In advanced cases, the thenar muscle located at the base of the thumb may weaken, causing a feeling of decreased strength in the hand grip. Other repetitive hand and wrist movements, such as knitting, gardening, and keyboard can also cause CTS. So with that said, prior to the pandemic, I wasn't on the computer so much. Now I feel like I'm on the computer all the time. So definitely my hands have been hurting because so much of the keyboarding. So I have to be constantly doing exercises with my hands. So here is a picture of the anatomy of the wrist, where the carpal tunnel will affect. Okay. So we're going to talk about a little bit of exercises in a few minutes of what you can do to avoid these things. Now, when we are using gloves, and gloves are ambidextrous, that means that you can use them on either hand. They can they can exert excessive tension on the hypothenar eminence. That's that fleshy elevation of the palm side of the hand, by forcing the hand to work against the vertical alignment of the glove form. Right or left gloves that are properly sized support the hand in a natural position, which properly positions the thumb, index finger, and middle finger. So here is a couple of examples of gloved hands. Now, your letter A right here where the arrow is pointing, they're showing what I just mentioned. Okay. But this is perfect. This glove hand is perfect. It fits. That's why they say it fits like a glove. Now, if it's too tight, it will actually start bending your fingers a little bit because the gloves are too tight. And if it's too loose, on occasion, you will let things slip. Now, will a glove ever fit you maybe just like this? Probably not. But you want to get close to it. Okay, you don't want it too tight and you don't want it too loose. You want it almost just right. Now, muscle strengthening exercises. So stretching and strengthening the muscles that support the back and neck, and those used in the forearm, wrist, and hand will help them remain strong and healthy. Stretch periodically throughout the workday before beginning any exercise program. Of course, you should check with your physician, particularly if you experience pain with any of the movements. Now, hand exercising. Some of these exercises, you can do it right now. So hand exercises, resting the hands frequently is believed to be one of the most important factors in preventing CTS. Use the exercise on the following slides to stretch and relax the muscles in the hand. So right now, if you're sitting down, you can open up your hands and close them into fists. Open them up, close them into fists. So this is what I've been doing because I've been on the laptop so much, okay? Then you want to press your hands together like in prayer, okay? That's going to help, all right? That's going to help the wrist. And then you want to gently pull and relax each finger of the hands separately, and you want to cross them and gently stretch and relax. Okay, so all these exercises are in your book. Now, eye exercises. To relieve eye strain caused by focusing intensely at one depth of vision for long periods, look up from the task and focus your eyes at a distance for approximately 20 seconds. And you want to practice this frequently throughout the day to use your full range of vision and lessen eye strain. Of course, you guys want to be watching what the doctor is doing and watching what you're doing, because you don't want to be suctioning the patient's tongue every 2 seconds. But sometimes when you are so focused on that, your eyes start crossing on you. So again, look away 20 seconds and look right back. Now, back exercises. To relieve stresses on the back, neck, and shoulders, try the full back release. Let the head roll. So this is it. Let the head roll forward slowly and allow the arms and head to fall between the knees. So while you're sitting down, you can be doing this exercise. And then you want to hold it for a few seconds and you want to slowly rise. And when you rise, you want to contract those stomach muscles and roll up. Bring the head up last. You don't want to bring up the head up first because you tend to get dizzy. The other thing is, if you get dizzy because you stand up from the chair too quick, you got to make sure you stand up slowly so you don't get dizzy, okay? When we make certain movements, and we'll be talking about this later because we experience these things also. It happens. We need to go and get something and we get up from the chair too quick. And, our body is not meant for those quick movements. So we might get lightheaded. Even if we're bending down and we get up real quick, we might get lightheaded. So if you have any of those feelings, it's because you made movements in your body too quick. Now, neck exercises. Try head rotations for neck stiffness. Head rotations involve tilting the head from right to left, as well as forward and backward without forcing the motion beyond your range of comfort. Shoulder exercises. Shoulder shrugging can be used to stretch shoulder muscles that may be stressed by holding your oral evacuators, which are your suctions, instruments, and telephone handsets. Pull the shoulders up towards the ear, then roll them backward and forward in a circular motion, just like this assistant right here, okay? So again, why was it important for us to speak about all this is because if this is truly your career, you want to be able to handle the stresses of the day from the sitting. And a lot of times our head are in a position that we're trying to look in the patient's mouth and we're always like in a slanty head motion. So when you finish, you want to make sure you do a couple of little exercises. A lot of times I did the exercises before going to work, like in my car. Every time I was at the light, I used that for start loosening up my neck, my shoulders, my hands. And then as I got to the office, I was ready for the day. And then on my way home, I did the same thing. At every light, I made sure that I basically, again, head, neck, hands, okay? Because if you want this to be your career as many years as I've said since I was a baby, okay? So you want to make sure that you want to be able to do this job. Okay, any questions? No questions.
No.